Hi, my name is Carlene King, and it's my honor to share my story and my long relationship with Cancer Care Services. I've been a resilient and outspoken advocate for Cancer Care Services since I walked in those doors in 2008. I'd recently been diagnosed with cancer and had been told about Cancer Care Services by Texas Oncology, but I didn't think that their services would actually be for me. At that time, I was a single mom with 2 teenage daughters, and I had a career as a real estate broker and an income. So what could this organization really do for me? I was told that Cancer Care offered free oncology massages. Now, that was something that sounded relaxing and soothing in the midst of those cancer treatments. I felt drained and extremely fatigued most of the time. So I scheduled a massage appointment at Cancer Care Services. I never could have imagined that a simple massage would lead me to finding help and support from that day on. I immediately felt at home in Cancer Care Services' living room, and it was on that day that I met a true sister friend, Jane Oderberg. And at that time, Jane was the program director, and from the moment we met, I knew that she genuinely cared about what happened to me. Although Jane has since retired from Cancer Care Services staff, she continues to be a mighty force for this organization. Jane serves on the board of directors, and she's a member of our Legacy of Hope Giving Society. But even more importantly, Jane is still my twin sister. When I walked out of Cancer Care Services building on that day 12 years ago, yes, I felt relaxed from my massage, but I felt so much more. They helped me financially with months of health insurance premiums. They also paid for medications I needed for my treatment side effects. They also talked to me. They listened to me, and they made me feel right at home. I continued with those massages the day prior to each of my chemo sessions, and those massages allowed me to go into those tough days feeling calmer and very cared for. And I believe they really helped me to cope with the unwanted side effects of the cancer treatments. After my treatment ended, I became a grateful survivor. And I was asked by Jane if I was willing to mentor some of those other clients who needed to hear from someone who had been down that same path. I was so happy to do so. And I ended up forging friendships with many of these women. I would call them just to check in on them. And most of the time, they just needed to talk, to cry, to vent. They just needed to be heard. I would tell them, just go ahead and talk. I have nothing else to do right now. I was happy to give them that same love and attention that Jane gave to me. So throughout the past 12 years, I've stayed connected with this resilient organization. I've served on the Cancer Care Services Board of Directors. I've been a volunteer, a mentor, and now I'm on the staff. This incredible organization does so much for so many. So it's just unacceptable to me that there are still communities in Tarrant County who are not aware of the free resources that Cancer Care Services provides. Since my first day knowing about cancer care, I tell everyone I meet, just call them. It doesn't matter which services you think will pertain to you, just call, and they'll find ways to help you that you hadn't even thought of. Remember, I thought all I needed was a massage, but then they helped me to pay for insurance, medicine, and more importantly, they gave me somebody to talk to about what I was going through as a single mom with cancer. Cancer Care support didn't just help me financially, they helped me emotionally, and it was all for free. And it's available to me forever. So today, I celebrate being an empowered survivor, and I feel thankful that my journey has led me to becoming a community health worker with Cancer Care Services. As a proud member of their outreach and health equity team, I strive to bring heightened awareness of our mission throughout Tarrant County. I've been a strong advocate for Cancer Care Services since that first day 12 years ago. And now I'm in a staff role that enables me to do even more to bring an increased awareness so we can serve people in all neighborhoods, especially those with the greatest needs. Thank you.